Hello everyone. My name is Tony Thomas. Joined with me is Fiona McCormack and Mary Paulos from Beaumont Infection Prevention and Control Team. In this short video, we will demonstrate how to put on a hazmat full body suit, that is from head to foot cover. The first part of the video, we will take you through how to put it. Then we will move how to work between patients, changing the appropriate PPE so that we can preserve the hazmat until you go for the break or end of the work. And my colleague will help me to don off the PPE appropriately in a safe manner. So to start with, outside the patient room, first we perform hand hygiene, clean our hands. So holding on palm to palm, with the back of the hands, 3 times each step, with the fingers interlaced, with the tip of the fingers and the nail beds, and the inner aspect of the hand, the thumb, and finally the wrist. It takes about 20 seconds, but in this process, our hands are made safe for patient care, free of the normal organisms as well as the organisms what we pick from the environment. The next step is to put on the hazmat. So I'll take on the hazmat and I'll take an appropriate position to sit down. I will open up the hazmat suit from its zip and I'll put on my legs first in sitting position. Once I have put my feet into that one, I lift it up over my hands, fix it up by zipping it gently. Okay, this is my opportunity now to put on my surgical mask and my eyewear. But because we are going to work between patients, this is the point we have to put on a single-use disposable apron. So put on your apron over your neck, spread it out properly so that it covers the front of your hazmat suit properly and provides you with appropriate protection. Tie the strap at the back, not at the front, just tie it at the back. Now take on your surgical mask and look for the colored surface which should face out and the hard margin which need to go over the nose. So since I'm wearing glasses for reading, I take off that one to apply the mask correctly over my face and covering my nose and my mouth. So I'm tying it over my head and I pull down the lower straps and tie it around my neck, covering the nose and the face. Once I have done, I position the mask, the hard margin safely with 2 fingers, molding it around my face, covering my face and my nose. Then on, I put off my reading glasses if I'm using one, and then I put on my goggles, which snugly fits into that one. Now, if you are not comfortable with the goggles, you may consider a mask with a visor, which is also appropriate. Once you have put on the glasses or the eye protection and the face protection, you lift up your hood. Over your head, fully covered. The final step of this one is that you put on your appropriate size gloves. As you put on the gloves, make sure that you put on the fingers correctly and then lift it over your sleeves, over the cuff, so that you will get the full protection of wearing the long sleeve cuff, and avoid any contact of this exposed skin with the pathogens or with blood or body fluids. Once you have done for one of the hands, repeat the same with the opposite hand. Now, this is all performed outside the room. The sole purpose of wearing a PPE is that the operator, we are protected from pathogens. So, clean hands, put on the hazmat, put on the apron, put on the surgical mask or the droplet precautions, and then put on the eye protection or the face protection, and then finally cover your head and then put on the gloves. Now you are safe to move inside the patient room, which I am going to do now. Now I am with my first patient. I'm helping the patient to sit up, maybe take a swab. And when I'm finished with my first patient, I have to change my gloves and I have to take off my apron. Keep the 5 moments in mind. Immediately after patient contact, remove the gloves and perform hand hygiene. In this step, because I'm going to work between patients, I'm going to demonstrate how we can safely put on PPE, that is after removal of the gloves and apron, how to put on a new clean apron and gown. First and foremost is away from the patient, take off the gloves, raise it up, gently reverse and remove, one glove at a time, and with one finger or two fingers, remove the second pair of gloves, and you can dispose it off into the appropriate waste stream, which is the risk waste stream here. Thereafter, you remove your apron just by pulling it and breaking the strap at the back and the straps at the back as well. Holding on at the back side of the apron, you roll it and dispose it off. After removal of gloves and your apron, we must clean our hands, because the hands are very likely to be contaminated during patient care or after removal or during removal of the gloves as well as the apron. So perform hand hygiene. Seconds. Hands are meticulously clean now. Now we are before going to the second patient, within that bay itself, or working between patients, you take on a second piece of clean apron and put on the apron. Again, we must, as a good practice, tie the apron at the back, not at the front, whatever is the size of the apron. Because in the process of removal of the apron, it's very likely that we can contaminate our hands. So once you have put on the apron, you put on your gloves again. We repeat the same steps here. As you wear the the gloves, you will make sure that it is fully covering over the sleeves. Pull the gloves over the sleeves so that it fully covers and you have the full benefit of wearing the long sleeve hazmat suit. Once I have put on my apron and gloves, I now step into my second patient to perform care and repeat the same process. Once I have finished with the care, I step away from the patient and then remove the gloves first, one hand at a time, and the second one thereafter. Dispose it off into the waste bin, and then remove the apron by breaking the ties at the back and at the necktie as well, holding it on at the back of the apron without contaminating or minimizing contamination of your hands. Dispose into the risk waste stream. Clean your hands, because at this point, once you're finished with the care for the day, or if you are taking breaks, this is the time you must consider removing the hazmat suit and the facial and eye protection. In order to remove the hazmat suit safely, you need the assistance of your body. My buddy here is Fiona. So I am stepping out of the patient room into a safe space where I can remove it safely. I have cleaned my hands, so I am not contaminating the environment. And this is a chance I am going to unzip carefully the hazmat. And now we need the assistance of the body to remove it safely. This is a process of reversal and removal. As you can see here, everything is going inside out. Any likelihood of contamination to the environment is minimal. And holding on to the inside out, I now sit on the chair carefully so that I can remove my leggings and remove it safely just by reversing and removal, one leg at a time, holding on to the hazmat, rolled it back in your hands, and the second one as well. Everything inside out now, safely disposed of into the healthcare risk waste stream. Now is the most riskiest part, which I'm going to remove my respiratory protection. So we must make sure that meticulously our hands are cleaned. Palm to palm, back of the hands, fingers interlaced with the tip of the fingers, with the inner aspect of the hand, the thumbs, and finally the wrist. How long it takes, Fiona? 20 to 30 seconds. Complete, full marks. So hands are meticulously clean. This is a chance I'm going to remove my eye protection. Again, if this is a reusable item, follow the instructions how to reuse. If it's a single-use item, you can bin it. But if it's a recyclable item, hold on for recycling. Now, the last step of this is how to remove the mask carefully. Never hold the mask on the filter surface, because the filter surface is with fluff, dust, and viral particles. And if you try to remove it holding onto the filter surface, we defeat the whole purpose of wearing a PPE, in particular the respiratory protection. So with clean hands, remove the straps at the back. Holding onto the straps, gently pull it down without holding onto the surface. Once the mask is removed or removed from the face, discard it. It's a single-use item. Never wear the mask around the neck or on the head, or hold on to the surface, filter surface. If you do, clean your hands. If the mask is off position from the nose and from the mouth, remove it, discard it, clean hands, put a new one. The final part of this one is we must make sure that our hands are meticulously clean, because we don't want to put ourselves at risk of infection. So there are 3 steps of hand hygiene at this point. So palm to palm again, follow the same sequence of the 7 steps of hand hygiene. And finally the wrist. Now I'm safe to go for my break, or as I finish my work off my hand suit, hands are meticulously clean, and we can continue with our routine task or leaving the work safely. Thank you.